Well, the COVID-19 vaccine wait, this could be a common frustration for many of you finding out and figuring out exactly when the vaccine can get into your arm.
Well, in fact, tonight our I-team is investigating the holdups for high-risk and transplant patients. They're under the age of 65. Consumer investigator Jason Knowles is looking into this issue tonight. Jason?
By Thursday, the governor says many high-risk and transplant patients, even under 65 years old, will be able to get on the 1B vaccine list in Illinois. However, it could all depend on where you live in the state, and you'd still have to wait your turn once you're on the list.
I had a heart transplant about 18 months ago and have pretty much been relegated to being at home.
59-year-old Scott Rosenberg says he lives in fear of getting COVID-19 as he recovers from surgery. He relies on his family to bring him groceries as he waits to be eligible for the vaccine.
Even pre-COVID, heart transplant recipients are immunosuppressed. In that we take daily medication to keep our immune system from attacking what our body thinks is a foreign object.
Despite his condition, Rosenberg is not in Category 1A or even in Category 1B. Recently, Governor Pritzker expanded the 1B category to include more high-risk people, including transplant recipients. But Rosenberg will not benefit because he lives in Cook County. It's one of several counties that are not moving forward with the expansion due to limited supply of the vaccine.
I'm also trying to think of others who are organ transplant recipients who are in the same situation as me medically, but maybe don't have the ability to have other people help them.
Rosenberg is getting care at Loyola Medicine. The hospital declined to be interviewed, but tells the I-team the hospital is following health department and public health guidelines, and it recognizes the need for all those in high-risk groups to receive the COVID vaccine. An infectious disease expert who is not associated with Rosenberg's case says in general, transplant recipients are at higher risk of bad outcomes from COVID-19.
These people, if they get infected with the virus, they're 80% more likely to get admitted to the hospital, 30% more likely to end up in the intensive care unit and to be on the breathing machine. And we're learning that their mortality is quite high.
Dr. Faiqa Cheema says she understands the overall supply and demand problem, but feels strongly that transplant patients and others in the highest risk categories should be prioritized.
People who are at high risk, whether they're undergoing transplantation or they're undergoing active chemotherapy for cancer, they should be included in the 1B group for accessibility to vaccines.
Vaccine priority is determined by states. Texas and New York have already placed patients with high-risk medical conditions in 1B. In Pennsylvania, many are given the highest priority, 1A.
I would think that people who are at extremely high risk, that the priority would be given to those who are not just susceptible of getting COVID, but dying of COVID.
Currently, the 1B expansions include several different high-risk categories, which will double the number of people eligible for the vaccine. Jason Knowles, ABC 7 Eyewitness News.